Starts with Alderman Bell. Regarding employee health insurance, are you going to drop city insurance, take penalties, therefore employees have to search for insurance, or possibly Obamacare?
Well, that's part of our employee incentive package for our employees. One of the big issues that came up is that our employees in 2016, they're going to be actually making less money at the end of the day than they were in 2015 because we raised up their health insurance and their deductibles. I wasn't opposed to raising their deductibles and their health premium, but not at the expense that we did. We raised their health premiums 150 cents, we raised their deductibles 1,000%. To me, part of having employees, we need to treat not just the employee, but their families accordingly. And we also need to have incentives for people to come to Mayville to be a worker. We do have a good program, and we do have one of some of the best workers, I believe, in Dodge County. And we don't have a lack of interest in employees trying to have employment here in the city of Mayville. And one of them is our incentive program for benefits and our wages.
Alderman Holman, your thoughts on the city insurance?
Sure. I led and helped reform city health care for our city employees. The thing is, we've got a great group of city employees, but they were paying $83 per month to have their health care paid for. Well, I don't pay that. I'm sure a lot of you don't pay that either. So I asked our city employees to contribute a little more. And to me, that was an important part of being able just to meet our budget as well. So contributing a little more, yes, we raised it to, I think it was around $170 per month. And then we added a nominal deductible of $1,000. Now, I just got done knocking on some doors and I was seeing, hey, you know what my rates for healthcare are? $400, $800 per month. For us to pretend that that wasn't a right move is wrong. Now, I know that we need to be competitive with other cities and municipalities. And oh, by the way, our police department, because we can't you can't really negotiate when it comes to healthcare. We put them in this just a $2,500 deductible. That's what they have. They don't pay a premium. But when I take a look at this boils down to his support of liberal ideology. He's president of a union. Of course he's the only one that voted no. He has to because he's got union support. He believes in the union. And his, I don't know where he's coming up with 1,000%. See, every time you put a percent down instead of saying a number, you know, it literally puts it in a different light. If they were paying $1 a month and I said I raised it 100%, now they're paying $2. Well, it's different. So, but the thing is, you got to remember, he's president of a union. This is part of his ideology. He could never vote for anything that would support it. Now, one of the things that I remember during the vote, the reason why he couldn't support it was because he says, well, I can't vote for something that's going to increase insurance to 100%. Well, he's the only one that voted no to it. Why? Why would he do that? And that's what you got to ask yourselves. It's because him and I believe different things. I'm a conservative, he's a liberal. He's a union president. And matter of fact, I think there was a letter brought out today and said that he owns a business. Really? Or he was president of a business. Well, last I checked, in 1935, FDR, that instituted the unions, well, and you can check with our lawyer, although he won't say anything, but you got to have articles of incorporation in order to consider yourself a business. The unions have no articles of incorporation to consider themselves a business. But he lied in his newsletter and says, hey, I'm president of a business. Well, that's fictitious because that's not what it is. And so when I really take a look at it, this just boils down to ideologies. Him and I are completely different in the way we view things. And I will say lastly, because I think this is the most important part, we've got a great city crew. They do great things for this city. They're out there at 3 in the morning. They're out there patrolling our streets. They're out there saving our kids' lives. But at the same point, I think that asking our city employees to pay a little bit more for health care was a right move because it puts them more in line with those that they serve. Thank you.
Thank you. Alderman Bell, for your response.
Yeah. Yes, I am president of a union, Communication Workers of America. I stated that in my open argument, in my open discussion. I support all workers, not just union workers, but all workers across this globe. I mean, I have been defending them in legislation in Madison all the time. That's who I am. But the reason I did, one thing Mr. Holman is wrong on, the reason I did vote against insurance increases is because at the end of the day, the city employees are actually going to make less money than they did in 2015, which is wrong. I mean, how would you like to make less money at the end of the day, $100, $200, $300 a week? And it's ridiculous. And as far as Mr. Holman, he raised the insurance premiums for the employees. They put them in the P4 plan, which is a $1,000 deductible. Then if that was equal across the board, then why did he put our police officers in the P7 plan with a $5,000 deductible? That wasn't even equal at all. That's another reason why I voted against it. As far as running a business, yes, it is a business. I pay my 940 taxes just like everybody else does at the end of the quarter. And that gives me the advantage over my opponent. Because I have the experience in negotiations and bargaining and engineering. I am the candidate that has the most experience running for this position. And I think that if you give me the opportunity to show you, I can make a world of difference for this city. Thank you.
Thank you. Your rebuttal.
Yes, he's absolutely wrong. The police department does not pay $5,000. It's a $2,500 deductible, and it's called the PO7 plan. It's not $5,000, so he's wrong in that. But again, our city employees are doing a fantastic job, and just like many of our citizens out there that work in their jobs and stuff like that have been asked to pay a little bit more for their health insurance, I think it was time to do the same. And if I was to do it all over again, I'd do it all over again. But here's the thing. I think the health insurance for our city employees is right where it should be at. So we are still very competitive with other municipalities, and we're very competitive with the private sector out there in order to retain and keep some of the best employees. And so he's absolutely wrong that the police department does not pay a $5,000 deductible. They pay a $2,500 deductible.
All right.